Katy Lees, Principal 340B Compliance Advisor with Virtue 340B. Hello and welcome back, or if this is your first time joining, I'm so glad you're here. If you are joining on my YouTube channel, you will notice that I am not on camera today. I am showing a graphic. I just thought that, this kind of culminated everything I wanted to share today. It's very similar to what I shared in a recent article and on LinkedIn. So if you are just listening, I hope you will get as much out of this conversation, and certainly, can find information or the visual aid that I'm sharing in another setting. So definitely go to LinkedIn or come to our Virtue 340B webpage and look for my article, 340B Growth in Context, which is exactly what I want to talk about today. I thought that it would be helpful if, other than the article that I shared, if I just kind of talked through some of these points. Those that know me or just have been listening to me for a little while, you know that I am a data person. I think that conversations and decisions need to be based in data and facts. Certainly, there's been a lot of talk lately about growth in the 340B program. I think that it gets off track oftentimes, or some of the information is being misconstrued or just represented in isolation and not in all the other factors that contribute to it. So that's where I decided a while back that I wanted to go to the data. So what does the data tell about the 340B program over the years? The 340B growth numbers that we see and we hear about, there's more spending year over year in the 340B program. But that's not just because more is being purchased or that there's abuse or that, anything is necessarily going wrong. There are many contributing factors, and I just wanted to kind of talk through some of them today and some of the data that I've pulled to kind of support my argument that there is a lot more that goes to it than just, covered entities are abusing the program and buying more drugs than they should be. Especially for the fact that this is coming up, in policy discussions. It's driving a lot of conversations, like in our federal and our state governments. It's come up in congressional hearings. We're seeing many ad campaigns, to talk about all of the problems in the 340B program and the growth that's happened. But it's not simple, nothing in anywhere is simple, but certainly not in healthcare. So what I did to pull this together is I wanted to look at, so we know that there has been more spent on 340B drugs year over year. On the chart that I have shared, it shows 2018 through 2024. And what I first wanted to look at just in my own investigation and research on this is, what does drug acquisition costs look like during this time? Because, it's not, this spending obviously is based on the cost of the drugs. So those spending numbers across, those years also has volume associated with it. So I'll just start, so that I don't forget down the line. When I pulled this data, I indexed it all so that it was all kind of, on a 0 to 100 scale, so that it's all, it can be compared, even though, at baseline, we're comparing kind of apples to oranges because we're comparing the volume of spending, again, in dollars, but based on volume, to acquisition costs from, I pulled that from the CMS website. That's the National Acquisition Drug Cost Database. And so what I did basically is take the average cost of brand name drugs over all of those years to see how that average cost grew year over year. And you can see that it grew, it's not exactly the same line, but it is a very similar trend line of, how the average cost of drugs grew to the 340B spending number. And, the other thing that I wanted to pull in there was just something to try to capture, how patient complexity has changed during that time period, because we're not living in the same world as we were in 2018. I'm pretty sure our hospitals were not consistently well over census on a daily basis in 2018, but that's the world we live in today. So for that, again, this is imperfect. I when I shared my thoughts of this on LinkedIn, I got a comment that the statistic of using the Medicare Case Mix Index is, really not the ideal data point. And I can respect that, and I understand. It's complicated, and that was what I ended up using. And I do think that it's a fairly good indicator of at least understanding like where our healthcare or our safety net providers are at, year over year. As you can see, if you're looking at the graphic, like this is the blue dotted line, it peaks in 2021. And it never has returned back to what it was prior to COVID, or, prior to the pandemic. So we've pretty much settled at that, just below that COVID peak. So, and I think anyone that works in the healthcare system, especially in a safety net hospital or safety net provider, this. This is not surprising. Like, we're living in a different world. Like, patients' needs have increased, tenfold. So those are the data points that I use just to kind of, at, as simple terms as I could, to show these are, some of the primary factors that have contributed to the growth of the 340B program. It's certainly not as simple as, it's not even abuse or, needless spending by safety net providers. And this is important. Like, it's okay if we want to talk about, growth of the program, because obviously it has grown, but we just need to talk about all of these factors so that it's, an actual productive, accurate conversation. I'm not going to go into all the details that I did in my article, but I hope that you check it out. But, ignoring that drug pricing increase does not like help the situation at all. It's just distorting the information. It's skewing what the real world situation is. Many communities are relying on safety net providers that participate in the 340B program. These safety net providers rely on 340B to support access to care, to make sure that they have the capacity to continue to meet this, like, just continued need within the communities. The original intent of the program was to stretch scarce federal resources and help providers reach more eligible patients with more comprehensive services. It takes more today to stretch resources to achieve that same purpose. Drug prices, patient complexity, and, provider financial pressures have all changed a lot. And so, like I said, the bottom line is not that 340B has not grown. Like, it has grown, but the real question is, can we talk about like what is actually driving that growth? I think that that's just really important. Like, if we're making policy decisions, which I personally hope that, our federal government can have a productive and accurate conversation about the 340B program. I think that our communities would benefit from federal legislation to protect the 340B program, to give it some stability, some sustainability. But if we're not talking about all of the right information and considering like all of these extra factors, then, how honest and real can that conversation be? So, just a super short video to share those thoughts. And, I welcome any feedback, and I hope you, appreciate the information. Thanks. Bye. Do you have a 340B compliance question? Send us a message at virtue340b.com. Thanks for tuning in, and we will see you on the next episode for more expert 340B advice. Talk to you soon.